This has been routine for Dr. Patrick Wu since February.
I just knew in the back of my head that we need to do something to protect ourselves.
Wearing masks everywhere he goes, months before public health officials recommended it. At home in Richmond, it was no big deal, but in cities with fewer Chinese, he says it made some uncomfortable.
Sometimes when we drive in the car, and then I forgot to take off my mask, and then so a driver will pull up and give me a look. So yeah, they weren't used to seeing people wearing masks, even driving a car or going to a grocery store.
Despite the stigmatization, many Asian Canadians have adopted masks and self-quarantining well before it was mandated. Kenny Zhang says even in January, some Chinese families drove 2 cars to the airport for pickups, one for locals, the other for the returning traveler.
A lot of people travel back from China to BC, and they put them voluntarily in a self-isolation for 14 days. A lot of cases, my friends, my colleagues,
they saw it coming and they did the right thing. And they did the right thing for both themselves and the rest of the community. So they should be applauded for that.
Numbers from the province are telling. Richmond, the city with the highest concentration of Chinese residents in the province at 54%, has the lowest percentage of cases on the Lower Mainland. They've also had no new cases since mid-May, the only health region in the Lower Mainland where that's happened.
Whether that is a direct impact of that early distancing and early aggressive maneuvers on behalf of the community, it's impossible to say, but clearly there's an association there.
With what we know already, there's no question that those Chinese communities where they took early action, they saw lower numbers of cases among their population. So I think that evidence is pretty clear.
Ian Young believes those good behaviors should be acknowledged. He reported on the issue when Chinese customers stayed home and business plummeted.
One of the key blunders was that officials were trying to pass this phenomenon off as something to do with racism, or that this was something to do with an overreaction.
When we asked Dr. Bonnie Henry about it on Thursday, she says the Chinese community did take the measures, quote, very seriously, but their contribution was part of the larger role that public health workers were implementing. As for Wu, he says he's just happy he did what he could to help protect the community. Leanne Young, CBC News, Richmond.